I mean, to be honest, in the past when we only had one child, both of us could, because she's in school, both of us were in clinic at the same time. So when he has to do surgery, I just see the rest of the cases. But now because we have a baby at home, so we're taking turns to take care of the baby. So most of the time, only one of us is in clinic. So if he has to do a surgical case, we have to let everyone know to be more patient.
Hi everyone, my name is Dr. Joon Loong. I'm a general practitioner working in Paddington Medical Clinic. And in this segment, I'll be talking about minor surgical procedures that can be done in a GP clinic. And this is Dr. Zhang, a family physician working in our clinic also.
Hi, I'm Dr. Zhang Huipei and I work in Paddington Medical Clinic. I'm a family physician and I see general practitioner cases as well as a range of baby and women's health cases.
So in terms of surgical procedures, a GP can do a lot of procedures in the clinic. It ranges from removal of lumps, excision biopsies of skin lumps, subcutaneous lumps, incision and drainage of abscesses and small carbuncles. That's the first thing. Second one is suturing. For any lacerations, deep cuts, wounds like that, adequately trained GP should be able to do this procedure. The next one is wound debridement, cleaning and washing of infected wounds as well as attending to these kind of wounds also. Next one is actually ingrown toenail removals via the wedge resection technique. Some GPs also can do foreign body removal, such as objects stuck in the ear, stuck inside the nose, stuck in the throat. Other things that include cryotherapy, which includes freezing of warts also. We talk about joint injections into the wrist, into the thumb, into the finger, into the elbow, and some GPs also do it for the knee injections also. All right. Lastly is actually ear syringing, removal of earwax, stuck earwax inside the ear itself. So till date, we have done over 1,000 procedures in our clinic. I'm proud to say that we've helped a lot of people with various injuries, various lumps and bumps and things like that. But there are three common procedures that I do in my clinic. Firstly is surgical repair of deep cuts and lacerations. Second one is incision and drainage of abscesses, okay, or boils, commonly known as carbuncles or boils. And thirdly is excision biopsies of lumps underneath the skin. So firstly, for lacerations or bleeding wounds, usually the patient will be calling the clinic and in a very panicky voice and saying that, look, can you guys help me with this problem? And over the phone, my staff will say, look, where is the location? How bad is it? And if it's acceptable over the phone, we'll get the patient to come to clinic. And meanwhile, my staff will actually inform me, even if I'm seeing patients, they will inform me there is an incoming case of a laceration over a particular region. And one of my staff will start to proceed to set up the room or the office for surgery also. So when the patient reaches the clinic, for example, just yesterday or the day before, we had one guy who cut himself on the finger itself. His finger was wrapped up and things like that, and he rocked up to the clinic. And even though the clinic was super busy, this guy actually pressed it, and my staff informed me immediately that this guy was here. They took his IC, one staff was registering him, and the other staff actually brought him to my room for immediate assessment. So we took out the dressing itself, the makeshift dressing, and we assessed the wound itself. So I would usually get a cursory look at the wound and see whether we can actually do the procedure in clinic. Some contraindications, or rather some situations where I do not repair, is if there's severe tendon damage, severe vascular damage, and if there's any bony injuries, I do not do any of these things in clinic because it's not safe to do, and it has to be done in the operating theatre in hospital. She sees the rest of the queue. I take my time.
So actually, I mean, to be honest, in the past when we only had one child, both of us could, because she's in school, both of us were in clinic at the same time. So when he has to do surgery, I just see the rest of the cases. But now because we have a baby at home, so we're taking turns to take care of the baby. So most of the time, only one of us is in clinic. So if he has to do a surgical case, we have to let everyone know to be more patient. Generally, our philosophy on kids is we try to put him in a little bit later in the school because they do fall sick really very frequently from our experience, and we do see a fair number of infants who go to infant care, mostly because parents have to work and all that, so we understand. So we do see a lot of sick kids, so we try to keep him out of school until he really needs to. So when he's a bit older and he's back in school, then we will probably start running clinic together again. Yeah. Anything to add? No.
Nope, nothing to add.
Yeah.
She's the boss.